Okay, hi everyone. Thanks so much for joining us today for this really exciting webinar exploring health aid accountability and the politics of data. This is part of the Kampala Initiative webinar series, which I'll touch on in just a second. But before we got going, I just wanted to take one really quick second to acknowledge where we are and where we're at in the world, and recognise that there are some really big challenges in the world going on right now around health, social, economic and racial justice that are all at the forefronts of our mind. And to just acknowledge that and take a moment to say thank you to everybody for being here. I think with everything going on, spaces where we can come together and connect globally are even more important. So thank you. And for joining us for this really exciting discussion. So the webinar was proposed by Sara Davis, also known as Meg, who's from the Graduate Institute's Global Health Centre and the Geneva Centre for Education and Research and Humanitarian Action. And I'll do a proper introduction in just a second. But before we get going, I just want to let you know that the webinar will be recorded. All participants are currently muted, except for when we get to Q&A, there might be an opportunity to speak. If you are tweeting, you can use the hashtags BeyondAid and Kampala Initiative. And our link to the webinar for more information about the Kampala Initiative is on the screen there. And I'll give you a little bit more information now about who we are. So we're a democratic civil society space and structure. We're a community of activists across northern and southern boundaries. We use this space to critique aid and to collectively build a new narrative on cooperation and solidarity within and beyond aid. And our focus is to come up with some concrete actions around specific areas of focus and thematic fields that we believe need civil society attention and action. Part of our activities are hosting a series of webinars. Up to now, they've been focused on the four focal topics of the Kampala Initiative, which you can see on the screen here. But we're really excited to be moving beyond these and also coming together to explore topics that link to building solidarity within and beyond aid, but also that need civil society attention and maybe action. So I'm going to hand over now to our fantastic panelists, starting with Meg. And let me give her the introduction she deserves. So Meg is an anthropologist and human rights advocate. She works at the Graduate Institute's Global Health Centre and the Geneva Centre for Education and Research and Humanitarian Action. She earned her PhD at the University of Pennsylvania and is the founding executive director of Asia Catalyst. Meg is the author of Song and Silence, Revival on China's Southwest Border, and her new book, which has just come out, is called The Uncounted: Politics of Data in Global Health, which I'm personally very excited to read. So let me pass over to you, Meg, and offer my warm welcome to all of you in the Kampala Initiative space.
Thank you so much, Tess and Thomas and everyone involved in the Kampala Initiative, which I think is a really important project. Can we advance the slide, please? Thanks. So today we're going to be joined by Dr. Carolyn Gomes, who's alternate board member of the Developing Country NGO delegation to the board of the Global Fund to Fight AIDS, TB, and Malaria. She's in Jamaica right now. Dr. John Waters, who hopefully is going to connect with us. He's having a little bit of internet difficulty, but he's at Caribbean Vulnerable Communities Coalition in Dominican Republic. And Hayden Barthelemy, who is Director of Finance and Operations at GrenChap in Grenada. So it's a real pleasure to be with us, all of you today, and we're looking forward to the conversation. I'm going to start by giving some framing remarks, and I'll pass over to Carolyn, and then if John is able to get connected, he'll join us, and then Hayden. So with that, we'll move forward. Thanks. So what I really appreciated about the Kampala Initiative and why we're so psyched to be part of this discussion with all of you is that it's drawing attention to these historical power imbalances in health aid. And there's been growing, previous slide, if we go back, thanks. There's been growing attention, I think, to this question of decolonization of aid, to thinking about the power relationships that shape aid, who makes the decisions, who has to implement the decisions, who's being held accountable for aid implementation. And so this book that I just published, The Uncounted: Politics of Data in Global Health, explores this rise in the use of indicators and data to make decision-making in health aid, including agencies like the Global Fund, but also others as well. And thinking about the political and economic forces that shape the selection of indicators, the construction of indicators, and the data used to report against them. How we produce knowledge, whose knowledge counts, whose doesn't, how we do counting, and who is it who gets counted, all these kinds of questions. And the way I did this research was beginning with ethnographic field research, looking at a study. So I was doing a study of a study, and the study that's going to be discussed that Hayden and hopefully John, if he joins us, will discuss, looks at doing key population size estimates, counting of numbers of key populations who are most vulnerable to HIV, sex workers, men who have sex with men, transgender people, people who inject drugs. So I watched this process of doing this research. And in addition, I did a lot of interviews with AIDS activists, leaders of global health agencies, like Peter Sands, the executive director of the Global Fund, and Ambassador Deborah Birx, who's head of PEPFAR, now also leading the COVID-19 response. Looked at global health policies, looked at the data and the models that are used to set targets, and really zoomed in and out between this kind of ethnographic field research that I was doing in partnership with groups in the Caribbean, and then with looking at the policies and the indicators at the global level as well, and looking at how all these indicators and data are used to make decisions that are life or death decisions for many people. So maybe we'll go to the next slide now, please. The process really began with a study that I did with some students and colleagues at New York University when I was there at the Center for Human Rights and Global Justice, where we explored whether there was a statistical association between laws that criminalize men who have sex with men and HIV outcomes that countries report to UNAIDS, which gathers all the data that countries report on HIV. And we grouped the countries into 3 categories: countries where same-sex sexuality is punishable with the death penalty, countries where it's punishable by imprisonment or fines, and countries where same-sex sexuality is not criminalized. And what you see along the x-axis is that men who have sex with men is a proportion of the male population, going from 0 to 2.5%. And what you can see is that countries that criminalize same-sex sexuality tend to have very small estimates of the number of men who have sex with men, which is not surprising because they're very sensibly hiding so that they're not subject to criminalization and the death penalty. And then the countries that don't impose the death penalty have slightly larger size estimates, and the countries that do not criminalize same-sex sexuality have larger size estimates. And UNAIDS says that size estimates below, I think it's below 0.5% are considered to be implausibly small. What that means is that you're basically not counting the people that you need to count in order to estimate how much resources you need to reach men who have sex with men in a given country. So this was not a huge surprise, though it was nice to be able to prove it. But on the next slide, what you'll see is what we also found was actually even more troubling, that criminalization was associated with higher coverage of HIV testing services. So what this meant is that countries that criminalize same-sex sexuality, as you'll see, there's a bunch of them that seem to be more successful in reaching men who have sex with men with HIV tests. And this didn't make any sense. So if you click again, you'll see we focused in on 12 countries that had reported over 90% HIV testing coverage among men who have sex with men. So these were the 12 countries that were skewing the balance and were making it look like the overall countries that criminalize are more successful. So 12 countries, what we did is we reached out to UNAIDS country offices, we reached out to LGBT and other community-based groups. One of the groups we reached out to was Caribbean vulnerable communities, and wrote to them and said, here's what we're seeing reported for these countries. I think one of them was St. Lucia, in fact, that was reporting like 95 or higher % HIV testing coverage among MSM. And we asked, why is this happening? Do you think that these countries are actually more successful? Are they doing something special? You know, always hoping that the numbers are actually accurate in some way. And what we got back was people who were, in some cases, puzzled, in other cases, flatly outraged, because they felt that these numbers did not reflect the reality of what was happening in their countries. What was happening is that countries that were reporting over 90% HIV testing coverage among men who have sex with men had implausibly small size estimates. So they were undercounting the men who have sex with men, and so that made it look like they were more successful. So for instance, Algeria reported 97% HIV testing coverage for men who have sex with men. They had tested 59 men, 57 of whom picked up their HIV test results. And so Algeria reported 97.5% HIV testing coverage to UNAIDS. Hungary had reported 100% testing coverage based on a sample of 300 men. And it was John Waters, actually, who said to me, what this is the denominator. If you have a small denominator, you get these ridiculous results. So criminalization really reinforces invisibility. It reinforces discrimination that already exists in our societies by making that discrimination less visible, by hiding it. So how does this play out when you enter this data into cost effectiveness analysis, which many countries are now being asked to do by UNAIDS and Global Fund and other health donors, because there's not enough money. And so you have to really try to target the money where it can have the greatest impact. And so cost effectiveness, very much a discourse and a tool that we've adopted from the private sector in many respects, are now being promoted as a tool for management of aid. So on the next slide, you'll see Goals Express, this is the very simplified version of this cost effectiveness software, and this is from their website. This is a sample case study from Nigeria. And what you see here is the different color bars represent different subpopulations. So you have IDU, injecting drug users, you have sex workers, clients of sex workers, and these different bars, when you change how much you're spending on interventions for these different populations, the HIV infection rate in that population goes up and down. So as the size of the bar changes, and you then create a picture that a health official can use to say, okay, we should probably target more money to clients of sex workers, because then we'll have a bigger impact on HIV testing rates. So you're prioritizing among interventions that focus on specific populations, but it really looks as if the populations are in competition with one another, and in competition with each other, and also in competition with the general population, so-called stable couples. Populations with small numbers, investing in them is inherently not going to be as cost-effective as investing in larger numbers of people. And so if you have, for instance, a group with small numbers, transgender people being the obvious example, never going to have very high numbers. Or if you have a group that has been undercounted. So if you have men who have sex with men in a country like Algeria, where they only counted 59 men, it's not going to appear cost effective to invest in those populations. So criminalization and negation of populations can lead to low size estimates, and the cost effectiveness analysis then doubles down on this discrimination. And in fact, discrimination is baked into the tools in some cases, because often the tools don't even list certain populations as an option. So transgender women, as you see here, are not listed as an option. Male sex workers not listed as an option. The health officials can input other populations if they wish, but they have to want to do it, and they have to have the data. So when I spoke to the designers of goals, they said, most countries don't have data on male sex workers, so there's no point in making it an option in the software. So the tools appear neutral and the data appears neutral, but the social and political context is not neutral that produces this data, produces these measures and metrics. So the next slide shows kind of a chart that depicts what Steph Baral, and you can go ahead and click through on all the, yeah, there you go, until you close the circle, there you go. Thanks. What Steph Baral and Matt Greenall have called a data paradox for men who have sex with men and other key populations. Basically, the absence of evidence becomes evidence of absence. You have government officials and others denying that the populations exist or negating that the populations are big enough to justify making an intervention. That denial and that lack of prioritization means there's no data about the populations and about their needs. The lack of data means it's hard to make a case for prioritizing that population for health services. And the lack of investment in health services then means we reinforce the lack of data. So it becomes this vicious cycle in which invisibility and lack of data reinforce one another. And it's a really problematic dynamic, especially given limited resources, and now with COVID-19, even fewer resources than in the past for HIV services. So the last slide just kind of frames, and since John, I think, is having trouble getting connected, maybe I'll just say a few words after Carolyn about what the study was, as I understood it. But this was funded by the Global Fund as part of their regional financing in the Eastern Caribbean. And they financed a 6-country study of key populations, trying to do size estimates to gather an estimate of the number of people that were in each country. And I got to tag along as a participant observer to watch, especially in Grenada, to watch some of what happened there. And what was interesting, I thought, as an observer, was how the research positioned civil society and communities at the center of the research as key players and thought partners in designing the research, implementing it, and analyzing the results. And the results that they came up with were extraordinarily rich, showing for the first time numbers of transgender people, in addition to men who have sex with men, sex workers, documenting gender-based violence in a way that had not been previously documented, and lots of other rich data that maybe Hayden will be able to speak to a little bit when he has the mic. I think one of the challenges is, and a challenge that happens in many countries, the key population size estimation studies are done, but they aren't always published because government officials are sometimes anxious about what might happen if that data becomes publicly available. And so this study also, as I understand it, has not yet been published, but I hope by talking about it and sharing this impressive work that we can help to draw attention and maybe persuade the Organization of Eastern Caribbean States to publish this study. So I'll stop there, and I think I'll turn over to Carolyn, and then we'll come back to talk about this study. Thanks.
Thanks, Meg, and welcome everyone. Hello across the world. The Developing Country NGO delegation to the Global Fund Board, we like to think of as representing those working for and with the uncounted. So we draw from the developing world, which includes, interestingly, ECA, the countries of Eastern Europe and Central Asia, as well as Latin America, Caribbean, Africa, Asia, Western Pacific, and we hope that we represent them adequately. Next slide. Very quickly, for those that don't know, the Global Fund Board has 20 seats, 20 delegations seated at the board table, 10 from the donor constituencies and 10 from the implementer constituencies. There are 3 civil society seats, which are taken by the NGOs from the developed world, NGOs from the developing world, and a representative seat for communities, which is those living with or affected by the 3 diseases, because it's not the Global Fund for AIDS, it's the Global Fund for AIDS, TB, and malaria. Each delegation has 1 seat and 1 vote on the board, and we make the decisions, policies, etc., and investment in the 3 diseases response. Decisions are taken by vote. 4 votes against are sufficient to block a decision. And the board, when we're not sitting together as a board, and we haven't been able to sit together as a board this year because of COVID, we pass electronic decisions. They're also passed in between sessions when it's urgent to do so. The Global Fund also has 3 committees which deal with the technical questions before they come to the board. These are the Strategy Committee, the Audit and Finance Committee, and the Committee on Ethics and Governance. Each delegation has 2 members that can sit at the board table. The board member, who is responsible for marshalling the delegations, making sure we have consensus, and for representing the views at the table. And then there's an alternate board member. I have the honor to be the alternate board member for the Developing Country NGO delegation. And we are allowed to speak during council meetings to represent positions of the delegation. Next slide. We won't linger on this. This is the 3. We have also, in addition, on our leadership team, a constituency focal point who is responsible for coordinating communications, coordinating the delegation, which, as you can imagine, 18 members across the world is not a very easy task. Our board member from May this year till May 2022 is Andrei Klepikov from Ukraine. And there's a picture of me which you can click past quickly. I've stolen this fund from one of our gazillion documents that come to the board, but they're also published on the website. So this sets out the 4 strategic objectives of the Global Fund. And as you see them there, they're to maximize impact against HIV, TB, and malaria. They are to build resilient and sustainable systems for health. They are to promote and protect human rights and to mobilize increased resources. Of course, if you have objectives and you are raising money to achieve these objectives, one has to be able to measure how one is achieving these objectives, what the work one is doing is how it is impacting your objectives, how you're achieving your objectives as you go through a period. And How do you do that? You have to measure with KPIs. KPIs, next slide, are key performance indicators. And so we have a raft of them, which get reported on at different times in different cycles, and they all attempt to measure the work and the progress towards the achievement of the 4 objectives. I was, I think, fortunately, not part of the team that worked on developing the KPIs for this round of the strategy. And I have tried to put together something about it. And I've decided that there's not enough time on this webinar, even if I had the whole webinar, to talk through the challenges and the process and the difficulties and the compromises and the consensus and the eventual decisions. And because it's such a consultative board and consultative process, you know what they say about a camel? It's a committee designed by, it's a horse designed by a committee. And while camels are very useful creatures for the desert, they're not necessarily very efficient on a racetrack. So unfortunately, some of the KPIs we produced were camels. Next slide, please. And I'm just going to take you through one of them to show you some of the challenges that we have with this comprehensive and earnest and hard-worked KPIs to try and measure our progress, to justify our existence, not only to the donors, but to those in country that we try and work towards these objectives as well when we give them funds. And the one that I want to talk through is KPI 9C, which is key population and human rights, domestic investments. It relates to our strategic objective 3, which is gender, human rights and gender. And it's, for the current allocation period, we were reporting on an interim indicator, which attempted to measure increases in countries' investment in key populations and human rights. So it's a domestic investments that the countries make in programs for key populations and human rights. And by the time we got to the interim indicator, we realized that what we were collecting, we couldn't, because global fund processes were not adequate to collect quality data on domestic commitments, and especially for human rights. And so I bolded commitments because I want you to focus on the fact that we're not measuring spend. We're just measuring what governments in countries say where they are going to spend. And we couldn't even measure that. So we're not measuring how the spend impacted anything. We're just measuring whether in fact they committed to spend the money. But it's a key indicator. And we arrived here by a long process of looking at how on earth do you measure whether we're improving human rights and gender equality? What do you measure? And it's hard. Next slide, please. So, as an example, and this is only one of a, as I say, a raft. I haven't even bothered to count them for the webinar, but we see long slide decks accounting for these indicators every time we have a board or committee meeting. So by 2020, in a 2018 to 2022 strategy, 2017 to 2022 strategy, we realized that that KPI that we developed so earnestly was really and truly a camel and was not fit for purpose on the racetrack. And so we had to revise our indicators. We had to define a new indicator in order to be able to even say that we had measured it in any comprehensive way. And so measuring the capacity of UMIX to the fund was not really working for us. So because there's no systematic process in the Secretariat to collect or validate this data. And so we came and we worked through and we ended up with a new indicator, which is based on the UNAIDS Global AIDS Monitoring Tool, with a refocused cohort and measuring the actual domestic key population and human rights investments against total domestic funding. I'd like to just say here that our success is measured against these key performance indicators. And we do try very hard to do better all the time. But often we are stymied, as Meg's book outlines, by lack of data. And it really poses a challenge to us as we go forward. But with great earnestness, we've passed a new key performance indicator for this. And we'll be using data that's already collected so that we don't have to recreate data and we don't have to try and collect it in a way that we can't. And it's based on the Global AIDS monitoring tool. I'd like to just point out here that the problem with the Global AIDS monitoring tool is that it is countries reporting what they're doing. And now we get back to the challenge of counting. So are they actually being able to measure how much money they're spending here? And are they actually reporting accurately? What are they considering as funding? And who are they talking to? How are they working through this? So again, at least it's reported and we can use it. But how much counting of the uncounted are countries actually doing? Next slide. I'm going to end you there and tell you that we do see the challenges of data for addressing performance problems and assessing progress. It's not a problem limited to the Global Fund. It infects national, regional, international performance measurement. And of course, all donors who need to see how well you've addressed the challenges they're trying to fund require it, but it has real problems. And how to make camels that should be horses give you information or win races for you is always a challenge for all of us, I think. And that makes Meg's book so timely and so interesting and such a good read. I'll now hand you back to our moderator and Meg, and thank you for listening.
Thank you so much, Caroline, for a brilliant presentation and for your kind words. I think you've really beautifully highlighted the enormous challenges with developing indicators and systems of accountability for aid that capture what we value in terms of equity and human rights. Fortunately, John was able to connect, which is wonderful. So John, if you're ready, I'll turn the floor over to you to speak about the study that you all did, because of course, the indicator that Carolyn was talking about only works if you actually have a sense of how many key populations you have and what their needs are. So we'll hear from John a bit and then from Hayden. Thanks.
Great, thank you. Yeah, I had some challenges with the internet this morning, so I had to move somewhere else to get connected. But let me just see if I can share the screen. Oops. I'm not quite sure how to do this.
Is John able to share the screen? Does he have to be a co-host maybe? I'm not sure.
No, I think it should work because I don't seem to be blocked.
Okay. Okay, thanks.
Are you able to see the screen there?
It comes, yeah.
Yeah, there we go.
There we go.
You just moved to presentation mode. Should be good.
Oh, yes. So yeah, I'm going to talk a little bit about an experience that we had, a specific experience that we had in the Eastern Caribbean, where we were essentially responsible for trying to put a number on the different key populations. And the key populations in the Eastern Caribbean were MSM, men who have sex with men, and sex workers primarily. So just to give you some context, the Eastern Caribbean is a region or sub-region of little islands in the Caribbean with different sizes of overall populations. that range from, I think, around 90,000 to a couple of 100,000. So we're talking about a country context where the overall populations are very small. And you know, just to say a few things about CVC, CVC is actually a coalition of NGOs that work with key populations. And we're the largest coalition of NGOs in the region, in the Caribbean region. And there's about 80 different members that we have throughout the Caribbean. And I think one of the things that is different about CVC is that we really work across the language barriers in the Caribbean. And that's something that's challenging to do. And it's something that I don't think many organizations or regional organizations have really managed to achieve successfully. So I think at least CVC to a degree has found a way of addressing this challenging issue of language, because we're able to work in the English, French, and Spanish and Dutch-speaking Caribbean. And we're essentially our work is essentially about improving the outcomes of key populations along the continuum of care, and advancing human rights of marginalized groups in the region, particularly given the discriminatory laws and the challenges getting redress. So I think one of the things that's important to look at is what traditionally has been the relationship between community-based organization like CVC and an academic partner. And traditionally, the way the setup has been is that, you know, we would be invited to partner with a university, typically an academic partner. And we certainly have been involved in numerous such relationships over the years, where the research institution is essentially responsible for developing the research protocol and to direct the data collection and then the analysis of the data. And essentially the CBO counterpart is primarily there to provide access to the target populations. And so having been in that role of providing access for a long time, you know, we certainly were aware of some of the limitations of and some of the frustrations with that. And, you know, we certainly have lots of examples of how that particular relationship, whilst it worked well for the academic partners, didn't necessarily work very well for us. And we frequently find that we had to deal with situations after the research was done, and we were left to kind of mop up after, you know, the academic partners had left. And a good example of that would be an MSM study that was done in Dominica. And Dominica is one of the smallest of the Eastern Caribbean islands, where, you know, it's essentially a very homophobic environment. And the whole study was very challenging to do. And because of the fact that community-based organizations were involved in being the link between the target populations and the study, they were often the ones that were seen as the responsible partners, or the partners that were the ones that had to, you know, really show their face to the communities. And so what happened in Dominica was that the results weren't really shared with the community-based groups. The results were collected, they were published, and the media got hold of the results. And that really caused a lot of problems in Dominica with, you know, some of the results that were being published. I mean, I think basically the general population, you know, had issues with accepting, first of all, that there were large numbers of MSM in Dominica, and really because the results were picked up on by the local media, and the academic teams weren't on the ground to answer. They would go to the community-based organizations and ask them about things related to the study, and they hadn't even seen the results of the study. So that kind of situation is obviously very challenging, and I think many of the groups that we worked with in the Eastern Caribbean, and Hayden can speak more about this because he's based in Grenada, is that essentially the groups have been felt used by academic institutions in doing research. So we wanted to make sure that CVC was able to participate in research because of the important data gaps that we have with the data in the region. But we also wanted to ensure that we went about it, you know, with a different type of relationship. And so essentially, we recognize that each partner has natural roles and abilities. But one of the things that we learned was it was really crucial to negotiate these things from the very outset, so that, you know, not to get involved in a relationship without really being clear on what all of these responsibilities and roles were, and what we were getting ourselves in for. And by negotiating all of this at the outset, it also makes it easier for us to insist on certain things that are necessary for us to participate in the research. And so I think clearly there are a series of issues that need to be worked out in terms of, you know, the priorities, the schedules, the capacity, the power relationships. All of that is good to work out at the outset so that each party is clear. And in this case of the OECS, CVC was actually the contracted partner. So that's also a little bit unusual because typically the contracted partner is the academic partner, and that can make it a little bit more difficult to negotiate things. But because we were the ones that were actually contracted, we were able to work with a partner that we've worked a lot with, that really understands the importance of giving community-based organizations a central role in the research. And so we were able to really work out a very supportive relationship where the academic partner was basically involved in calculating some of the demographic stuff and helping us think through some of the methodology, because of the fact that most of these methodologies have been developed for a very different situation. I mean, the population size estimate studies, of which, you know, this was the objective of the OECS study. These studies, you know, have been basically developed in places like San Francisco, California, where there's large numbers of MSM and transgender persons and sex workers. And so the actual methodology really needed to be changed and adapted for the realities of the Eastern Caribbean. And, you know, one of the important adaptations was that we realized that we didn't have the luxury of doing essentially a qualitative study to help us inform the quantitative study that would come afterwards, which is what's typically done. Because in a place like San Francisco, you can access lots of sex workers and you can access lots of MSM, And you don't need to go back to those same individuals. But we were very much aware that with much smaller numbers, it was not going to be possible to capture individuals on 2 occasions. We would only have 1 shot to capture them. And so we essentially also found that by involving individuals in the qualitative part of the study, we were able to obtain a lot of very interesting and useful information. And so we did that part of the study after the initial protocol was approved and we had IRB approval. So we were able to use that information in the study, and that proved to be very helpful. So we actually set up, or we're still in the process of setting up, but it's certainly a you know, a priority for me and for CVC to set up a research institute or a center within CVC that can actually take on this work of ensuring that we're able to negotiate better with academic partners, that we're able to set the research questions, or at least be heavily involved in developing the research questions, and also to build the expertise, because, you know, we really feel that the local communities have so much information, so much understanding, and that is worth its weight in gold. And so sometimes I think we shortchange ourselves as community groups because we don't really realize how important and how valuable that information is, and how we can use that knowledge to jostle for a, you know, a better place in terms of the partnership. And obviously, you know, it's all about making win-win situations, because by joining with academic institutions, we are also able to gain quite a lot in terms of our research knowledge, in terms of our credibility. And sometimes I think an organization like CVC, which is very focused on activism and advocacy, can sometimes lack a reflective lens that, you know, by partnering with an academic institution, we can really take some time to step back and look at things a little bit differently. But, you know, we must be aware as well that these relationships are also very useful for the university or academic partners. And
John, I'm sorry, we're going to have to ask you to wrap up because we don't have a lot of time. Thanks.
Yeah, this is my last slide. So yeah, it really needs to be a win-win situation, and academics also greatly benefit through sending us students to be able to think through some of the theoretical stuff and see how it plays out in the field. So in sum, I think it's really important to be aware as community groups of what we can bring to the table, and really to better negotiate a relationship with academic partners that's more on a par. Thank you.
Thanks so much, John. I just want to make sure we have time for Hayden and also to answer some of the great questions that are coming in. So please continue to submit your questions in the Q&A box. Maybe we'll go a little bit over time if people will allow that. With that, it's a pleasure to pass the microphone to Hayden Bartelme from Grenchap. Hayden?
Hi, so good morning, everyone across the world. So my name, as Meg said, is Hayden from the island of Geneva in the Caribbean. A lot of sun, sea, and sand. And I will be more or less giving you a perspective of the on-the-ground aspect of the survey. Now, in the Caribbean or the small islands, as would have indicated earlier, the main problem is data collection. And so there's not much data when you're writing a project, or if you have to confront the government on policies and procedures, there's not much data to really present along with your claim. And so when the opportunity came along for this part of the venture, a lot of the islands jumped on board because we needed data. at least to have with us. And so it was very important for us. Bearing in mind that majority of the islands still decriminalizes, criminalizes actually anal sex, minimal of 10 years imprisonment across the Caribbean, most of the Caribbean islands. They're still on the books. Every time you challenge the governments with it, at the UPR reports, they keep saying that no, they're not using it, it's just on the books, but that is always a challenge. Another thing for us is that why we needed the data is that a lot of the organizations, when we started up to represent some of the community members, because of security purposes at the time, we never had a membership base. So we never had a register of community members who would come in and register with the organization, because we did not want to have it on any paper or any software along the line for persons to get into wrong hands. So that was the reason we really jumped on the whole data doing the survey. And obviously to do that, we would have had persons trained in the islands on the data collection and how to conduct the interview with the participants. Now, some of the challenges we would have had is that persons, as John would have indicated, that in some of the islands, we had other organizations and other academic organizations came through before and collected data. And those informations or those studies were never fed back into the population. There was no results, so, and for persons in the population, they saw no change in giving it when they had those interviews done. And so what we found happening is that persons who would have been through that process already outright declined to take part in the survey, because they think that, okay, there's just another organization coming to get information, and nothing is going to be done about it. And so they refuse, some of them refuse. They had to really speak to them and get them into a comfortable mood to really take part in the survey. The other thing is that because the communities are really small, word spreads very fast. And so in a lot of the instances, by the time we hit the ground in areas as known hotspots to conduct some of the interviews, we ran into a couple of problems along the line. So in particular, you had one place we had set up to, we got permission to set up to conduct interviews from a gentleman in the community. And by the time he left his home, somebody phoned his wife, in another country to tell him, there's movement or there's people going in and out of his space. And so we had to rethink that one. Even when we were going through the community, at one point in time, we actually had to change vehicles, because persons now got accustomed to seeing the vehicles and knew what happened. And so we had to change vehicles, just for not to raise awareness. The other thing that happened is that community members, especially for the sex workers, persons in the community know who the persons are, and they're very protective of them. And so it was very hard sometimes to get information from some community members. The methodology which we use, which was a referral, it worked, but as again, because of the community being that tight-knit, it was difficult at times for us to really get onto some other persons or get persons to come out after a certain time. Another thing that happened during the survey is that because we have a lot of subgroups under the various groups of the MSM and stuff like that, you'll find persons are not acquainted with a lot of the information, and there's a lot of myths out there that a lot of persons hold on to. And so when we were doing the survey, there were times that the interviewers had to literally try to explain some of the terminologies for the interviewees, so they can understand what we were asking. So they were not aware of some of the terms, and so we had to literally go down as low as possible to really explain to them what what we meant in some of the cases. We also, at a point in time, we also needed to do things to boost the numbers. And in terms of, when I say boost the numbers, again, yes, we were using a referral process, but like in the early or sometime middle of the time allotted to collect the data, we actually host social events, private parties with persons in the community to really try to help get the word out there and to help spread the word to get them to come in and to be part of the survey. And another thing that we experience is that persons in the islands prefer not to speak to somebody or someone or interviewer from their home country. They feel uncomfortable because the actions have been hidden, and so persons already know what they're doing. And so speaking to someone in the island would more or less opening up themselves about their sexuality. And so you find that a lot happening is that while we travel through the different islands, persons would have preferred to speak to someone off island, you know, and do the interview along with them, because they have this certain mistrust among themselves within the community. Some of them might have had bad experience in the past, and as a result, that would have done that. As John says that, you know, still coming back from that, we have not been able to really publish the survey, the results as such, because there are a lot of interesting facts that came out during the survey. And so we are yet battling up along those lines. There were information concerning persons involved in religious organizations, in government ministries, along the line, being part of the survey. And so it's yet for them to accept and to really take on that aspect of the survey. So yeah, that is basically it from my end. If there's any other questions, then we can go further in when we go along.
Fantastic. Thank you so much, Hayden. And it's so great to hear you describe it. It brings back a lot of memories last few years. And it's just such a rich experience that you all had in doing this work. So the questions have been flooding in, which is really great. And I think we'll start with one that I know Carolyn is eager to address, which came from Miria, about the role of civil society in advocating and engaging on the key performance indicators at the Global Fund. Carolyn, do you want to tackle that one?
Sure, and I just love if Tess could put up back the contact for us, because our role as the developing country NGOs representing the populations from the developed world is to take, and we invite and welcome input. We are always, please visit our website, and we are always looking to receive information, share information, and get feedback. And now actually is a really good time for CSOs to input, because the Global Fund begun the process of developing its next strategy. And on the Global Fund website, there is a interactive website that allows you to read, to understand. While we're not doing key performance indicators now, that follows the step of the strategy, there is a wealth of information on both our website and the Global Fund's website with links. If you go up a bit, Tess, you'll see where we have the website for the delegation. And we want to hear from, would like input from our colleagues across the world in CSOs, NGOs, as they are, back one, sorry. Thought come forward, yeah. I thought the website was on there, but no, sorry, I will get the Facebook link, but Leslie can link you to it. Leslie's, the focal point is there, her email is there, we share these, please reach out, please let us know, and please interact with the Global Fund website. This consultation process will be ongoing until about mid-year next year, and the website is up, open, has information, and has space for you to put your thoughts. We will be collecting those thoughts, but if you'd like to share them directly with us, please do. We will be collecting, we will be consulting over the course of the next 9 to 12 months with civil society across the developing world to try and make sure that the richness of the perspective that they bring is captured in our voice at the board.
Thanks a lot, Karen and Carolyn. I hope you both get a lot of good input from people and also recruit some new delegates from this conversation today, because I know you guys are always looking for people to join.
Absolutely.
Share the work,
Absolutely.
share the documents. Yeah, that'd be great. I saw we had an interesting question from Margaret asking about the use of online tools and technology to gather data, and especially in ways that protect anonymity. And I know that's something that the CVC and Grenchap and others study really try to do. And I wonder if John or Hayden, if you wanted to speak to the tablets and how you use those, because I thought that was an interesting aspect.
Hayden, do you want to talk a bit about the tablets?
Okay, so yeah, so we did use technology in collecting the data. So each interviewer were equipped with a tablet. The software, I think we were using Android Survey, was installed, and so the questions would have been on that, and so it would have been easier when we go out, when the persons go out in the field to actually collect the data. Once they get back in, you upload it. Once they get a Wi-Fi hotspot, the questions are automatically uploaded. The answers are automatically uploaded to the server. And so that is what we use. We had at least almost like 10 tablets for persons to use within the region for the survey. So yes, we did use technology, and it really worked good for us.
Yeah, maybe just to add as well, there was a tremendous amount of pressure on us to divulge information related to the GPS. You know, basically we were contracted by the OECS Secretariat, which is like the governments of the Eastern Caribbean that come together. They were the organization that contracted us to do the study. And we had said from the very beginning that we would not share GPS information because the islands are just too small and the information can be too compromising. And I think most importantly, because we had promised the participants that we wouldn't share any of that information. Nonetheless, they really pressured us, and they tried to argue that it was a global fund that was asking for this. And so yeah, I think it's important to point out that it can also be a danger. What we ended up doing was that we ended up providing some information in terms of some of the hotspots, but we disaggregated that information from any personal information. Because obviously on a small island, if you're a 50-year-old man who is from a particular area, that information, you know, when you start sharing that, you can actually identify who that 50-year-old gay man is, because there's not a lot of them in a small place, and so that can be very compromising.
Thanks, John. Yeah, one of the things that struck me in Grenada is how everybody knows everybody else. And I had a friend who said that, you know, if he stops and his car breaks down, you know, he'll have like 10 different people stopping their cars to try to see what he's doing and see if they can help. So privacy becomes very complex to negotiate in a setting like that. I saw we had a few people asking, and I think this is probably maybe a question for Carolyn, though others might want to weigh in about, and I'm going to group them all together in the interest of time, about the priorities of the Global Fund, which is a mandate and is founded in response to a global movement to address HIV, TB, and malaria. But what about non-communicable diseases, NCDs? What about the fact that people don't have food, especially in the current moment, lack of food security, nutrition, you know, other urgent priorities? So should the Global Fund be changing its mandate? And what are your thoughts about that? Carolyn, I'm going to put you on the spot there.
Yeah, we're jumping right into a discussion that we're actually having at the Global Fund Board. And the Global Fund was founded with a specific mandate because if we looked at deaths across the world, not just from AIDS, which was the pandemic that sparked it, but from TB, untreated, undetected, from malaria, then those 3 diseases were the major killers. NCDs obviously are a rising problem, a rising issue, particularly in the context of income inequalities, access to good food, etc. But they are not the mandate. And to change the mandate requires us to very carefully look at at the success, and here we come back to data, of the mandate of the fund. Have we done what we set out to do? Have we managed to reduce the death rate? Have we brought the epidemics of TB, malaria, and HIV down to manageable levels? This is the money that the donors give us to do that. Along the way, we have broadened the mandate in the sense that we look at the contribution of health systems to us achieving our mandates in terms of ending the 3 diseases or making them no longer a threat to humanity. But it's health systems within the context of delivering on our mandate. And it's human rights and gender equality within the context of delivering. How is it that the human rights of key and vulnerable populations to malaria, to TB, to HIV are being respected or breached in order for us to more effectively address those key populations' vulnerability and their needs for access to healthcare. But COVID has thrown the whole world in a spin, and the Global Fund has responded, I think, with great agility with the provision of additional funding to support COVID efforts across the world. Initially, just to allow governments to access the PPE and the basic diagnostic tests they needed to be able to control the epidemic of COVID. And with the more recent C19RM, actual applications from the governance structures on the ground, which are the CCMs, which look to protect their programs against AIDS, TB, and malaria in the context of health resources being diverted to fight COVID, and there being lack of attention to the needs of the key and vulnerable populations. Whether and what role the Global Fund will take in the larger health architecture, international health architecture, in attempting to address the 2030 SDGs, in helping to steer countries and the world towards universal health coverage, and what exactly that means is a conversation we are having. The absolutely immediate needs for food, for medication, for access to healthcare are discussions we're having. At this point in time, there is no agreement to support food, though that's something we keep raising and we keep asking, saying that people can't take their pills if they can't eat, people can't do anything if they can't eat. But it's a conversation that's ongoing, and we'd love your input. We have posted in the chat our website and the website linkage to the discussion that's ongoing at the Global Fund. So feel free, make your interventions, read the documents, see where we're coming from. Yes, we're having conversations. Yes, this minute has thrown up for us the weaknesses of our global health, thrown up for us the weaknesses of our public health systems in our countries, and some unexpected places as well. As one of my fellow members on the board said to me, you know, we now on the donor side see some of the problems and challenges equally affecting us from COVID. So conversation continues. Feel free to join and to reach out to us.
Thanks, Carolyn. I think maybe we'll close with a question coming from our co-host, Thomas, which might be a question for John or Hayden, or maybe for Carolyn, for any of you. But I think one of the questions is, I mean, since the premise of this panel is challenging the realities of aid, right? So the role of donor pressure on dealing with those most marginalized, I mean, is the presence of funding from an agency like the Global Fund to do this kind of study, do you feel, John and Hayden, that it's changing the dynamic, that it's causing more attention to the needs of key populations in the Eastern Caribbean, or would have happened if the donors hadn't been engaged?
All right,
Yeah.
so
Go ahead, Hayden.
okay. So yeah, because of, and we normally will see that happening sometimes, because of the funding have been made available and been given specification of groups of persons to work with that the governments don't have a choice than to work with a group. So what we are doing now, because right now for Grenada, for instance, Grenchap and the government of Grenada has a really good relationship. But we think it is based on the person in the chair. And so as we have the opportunity now, based on the person who's in the chair, we're trying to get things in place that no matter who is in the chair, get policies in place no matter who is in the chair, that the organizations on the ground that do the work would be recognized, and by extension the population. So it's a bit difficult sometimes, but 95% of in the past is because of the funding available. Yes, they work with the population, but now we are trying to get that to change.
Thanks. John, did you want to come in on that point?
Yeah, I mean, just maybe quickly to say that, I mean, definitely the governments in the OECS were obviously motivated by having this funding. It's interesting and important, I think, to note that the study has not been published and the government has not authorized the study to be published. So, you know, I think what concerns me is that they say yes because they want the assistance, but when it actually comes to putting the data out there, they really get cold feet, and it's not so easy to get them to release the data.
Thanks. Carolyn, any reflections on that?
Yeah, that is the challenge for aid, and how do we balance a good, who's good, and against the question and the tension of country ownership. Because one of the things that country ownership and that country sovereignty does is allow countries that are wanting to ignore those that they don't want to count. So how good is the aid? How good is the pressure with the aid? And how do we usefully balance that with the human rights questions, tensions, and realities faced by people on the ground? And yes, if we've signed on to the conventions, then an important way of forcing governments to keep their conventions is for others to empower those working to observe the human rights conventions, the needs of all of us, because equity is the principle and equality is the basis.
Beautifully said, thanks. Yeah, and I think, you know, I've seen some questions here about aid accountability and how can we use pressure to press for more accountability. And I think this is really the question I was trying to explore with the book, and that I think all of us wrestle with in different ways, which is, you know, how do we measure accountability? Everyone claims to have done what they are supposed to have done. Everyone claims to uphold human rights and the right to health for all. Everyone claims to uphold gender equality. And then how do you actually assess whether that's been done in practice? And increasingly, we've moved towards this quantitative approach, this audit culture in which we measure things and report data and use key performance indicators, which are very much adapted from the private sector. But in the end, I think we wind up what the indicators do, which I think, just to wrap up before I hand back to Tess, what I think these key performance indicators and all this data does is it creates space for us to have these debates. Because I think the tools by themselves don't necessarily tell us what we need to know, but they give us a chance to talk about whether or not we're making progress. And in a way, you know, when we look at the bilateral aid agencies, PEPFAR, DFID, JICA in Japan, the European Union, there's no key performance indicators, there's no civil society role in governance. And so we don't really know what happens with their money. The World Bank, who knows, right? I mean, I'm sure somebody does, but whether it's somebody who is transparent, accountable, you know, like Carolyn and others really trying to take input and do some representational work, that we don't generally see with these other large donors. And so I think that's something to reflect on. Maybe these indicators don't do what we want them to do, but at the same time, we have even less visibility in places where we don't have indicators in civil society and the board, and even less accountability. So no easy answers. And with that, I'm going to pass the mic back to Tess. And thank you so much for creating the space for us to gather and to share.
Just before you go, Meg, that's one thing I wanted to add. That one of the positive things we saw coming out of this survey also is that now within the region, we now have legal cases, challenges being mounted to challenge the burglary law in at least all of the islands, the 6 islands, the VCS islands. And so they should all be filed most likely by next week. It's just one country, one island we are waiting on to file that challenge. And the good thing, one of the good things about COVID for us is that the cases can be heard online. So persons don't need to show up in court. So maybe that's one of the good things that COVID provided for us. And so we're using the opportunity to file the cases now and for them to be heard via technology.
Thank you very much for sharing that. It's very interesting development. I wish we had more time to dive into it because it's super interesting, but we've already gone over. So thanks so much. And thanks to all of you. And thank you, Tess and Thomas.
Thank you so much to Meg, Carolyn, John and Hayden. That was so interesting and really great to bring this topic to the Kampala Initiative. I know we've run out of time, so I just wanted to finish really quickly by just letting you know, if you aren't already part of the Kampala Initiative, how you can get involved. So we have a Kampala Declaration, which you can sign as an individual or organisation. We're continuing our series of webinars, and there's a couple of links to the website here where you can find this information. We have a mailing list where we share a lot of information about the webinars, but also articles and things we're interested in and have more focused discussions. We have thematic working groups working on a variety of focused issues, and we're also looking to expand the work we're doing into other areas such as country teams and more as we emerge and as we develop. So yes, thank you so much to the fantastic panelists. It was really wonderful to have you here, and thanks to everybody being here in this space for this afternoon or morning, depending on where you are. And yeah, have a great rest of the day.
Thank you so much.
Thanks a lot. Have a great
Thank you
one.
much.
Yeah, thank you, everyone.
All right, bye.
Bye.
Bye.